Good afternoon. This is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare, and wellness, from conventional to alternative and everything in between. My mission is to change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel that you are stuck in a dark place, I want to tell you there is a light at the end of the tunnel. Today, I'm with Leona Burkey, the Executive Director for Brain Injury Nova Scotia and a non-profiteer, activist, and community educator. Welcome, Leona, on my show. Thank you for coming on.
Thank you for having me, Dr. Christine.
Well, it's okay just to call me Christine because I'm here just as a normal person. But Leona, tell me a little bit about yourself, your story, and how you got involved with brain injury rehab.
Sure. I've been the executive director of Brain Injury Nova Scotia since 2014, and I got involved with the organization in the beginning as a volunteer because my sister has a pretty severe brain injury, which she incurred in the late 90s. And I was looking for some programs and support for her and got involved in the association. And then one thing led to another, and they were in a position to bring on some staff, and I moved into the role as executive director since 2014. So the organization itself has been around for 29 years. And Brain Injury Nova Scotia was founded by a group of families, parents and husbands and wives of people living with brain injury. And over all of these years, we've been trying to improve services and supports in Nova Scotia for Nova Scotians living with brain injury. When I got involved, I was quite shocked to realize that there are little to no appropriate publicly funded services for people with brain injury. And as of late, we've been in the news. We've worked on a acquired brain injury strategy for the province of Nova Scotia with the Department of Health. And that was a learning process for them as well. And I was happy to come on today just to kind of raise awareness of brain injury in Nova Scotia. The sheer numbers of people that it affects tends to shock the average person. There are estimated around 3,000 new brain injuries every year in Nova Scotia. Now, an acquired brain injury is any physical or medical injury to the brain that occurs after birth. So that spectrum includes mild traumatic brain injuries, which many people know as concussions, all the way to more severe traumatic brain injuries as the result of car accidents or things like that. And in between, we have everything from stroke to aneurysm to oxygen deprivation type injuries, brain infections such as encephalitis, meningitis, and basically everything in between. So brain injury currently could be affecting up to 90,000 Nova Scotians. So that's a great deal of people.
Oh, that's for sure.
It's always, it indeed it is. And it's always good to, when we have an opportunity to raise awareness,
yes,
we take it.
It is such an important cause because what are we without our brain? It is the most important organ we have. Right.
We're nothing without it. Yeah.
Now, you named a few of the more common injuries to the brain from all sides, whether it be an accident or an internal process like a stroke, which can be a bleeding or a blood clot that occludes the arteries, or infections. So there's a few.
Yeah.
And lately we have heard a lot about concussions, which is something that affects young people. Let's talk a little bit about how it affects people when their brain gets injured?
Mm-hmm. Well, brain injuries are as individual as the injury itself. But speaking to concussion specifically, a lot of people phone us for information and support around the issue of concussion. 1 out of every 3 kids will have a concussion before leaving high school. Wow. And many parents phone particularly concerned with the children that have had more than 1 concussion. So basically any active sport, any contact sport, even everyday activities present endless risks for even mild traumatic brain injuries such as concussions. We have lots of research emerging about the long-term effect of repetitive concussions, particularly in younger years. And we're also seeing now research emerging that young women and women in general tend to be more susceptible to prolonged effects from a concussion.
Now let me ask you a question that many parents probably ask you. How do I know if somebody that banged their head has a concussion? I mean, years ago, the typical symptoms were a headache or loss of consciousness or nausea and throwing up. But there's more subtle signs that are coming out more lately. So tell me a little bit about that. I'm sure you have all the newest research about that.
Yeah, well, I think one sort of a myth that's out there is that you need to be unconscious you need to be knocked unconscious to acquire a major concussion. But that's not the case. Symptoms can often be quite subtle, and any sort of jarring blow to the body, it doesn't even have to be a blow to the head, can result in a concussion. So basically any direct blow to the head, face, neck, or anywhere on the body that causes a severe and sudden movement to the head, because the brain itself is suspended in fluid inside your skull. So a direct blow that causes a sudden movement can cause the brain to sort of bounce around inside the skull. And if it hits at the forward part of the skull or perhaps bounces back, sometimes very microscopic damage can happen, or micro damage can happen inside the brain. So some of the common signs and symptoms, Christine, are things that we know, certainly. Headache, pressure in the head, neck pain, dizziness, problems with balance. Sometimes with more severe concussions, people feel nauseated or vomiting happens. Oftentimes, though, there are vision problems after a concussion or hearing problems, so sort of like a ringing in the ears. And oftentimes our young people report just not, they don't feel right. They feel dazed and a little bit confused, or they feel like they're in a fog. Other subtle symptoms can include drowsiness, fatigue or low energy, emotional issues, so feeling more emotional than usual or irritable, and difficulty concentrating or remembering. So all of these things sort of make up a pretty large list of possible symptoms.
Yes, and a pretty unspecific list too. So it's hard for parents and coaches of sports teams to say, is it a concussion or is it just a teenage thing? And how do you differentiate that?
Exactly. That's one of the tough parts. I mean, I know a lot of sports organizations and coaches are using something called baseline testing. So they use basically a measurement tool to measure their athletes when they're healthy, so that if a concussion is suspected, then they can A/B those measurement tools to see if any symptoms are popping up or there's any remarkable difference between the two. So there's many of these kinds of tools available. One popular one is called the SCAT test, and that's used by a lot of current coaches and people that are involved in athletics. So, that basic baseline test is very useful for athletes. But for a lot of people that just slip and fall, they don't have a baseline test, to refer to.
So how common really is it? Because what you're saying is that lots and lots of people would fall in that category, even somebody that slips on the ice and hits the head.
Yeah, absolutely.
Mm-hmm.
So, when we're looking at about 3,000 new brain injuries a year in Nova Scotia, many of those may not even go through an emergency room or what have you. Many mild brain injuries are not admitted to hospital or may go undiagnosed, and 80% are classified as mild.
So
or,
probably
sort of
the 3,000 is rather understated.
Yeah.
Is that right?
Yep.
Yeah, because everybody that
absolutely.
has a major traffic accident will have a concussion.
Yeah, a lot of people will. Yeah,
wow.
and after a major accident, well, it's most likely you would go to emergency.
Yes.
Or, you would either go into hospital or at least go see your doctor or what have you. But, there is certainly that element of mild brain injuries that may go undiagnosed, which is certainly a public health problem, especially if people have persistent symptoms and they're not exactly sure why.
Okay, that is really a good point to end the first half of the show. And here on 97.5 COAE FM Community Radio. And please tune in after the commercial break for more with Leona Burkey. And we'll talk a little bit about what can be done to heal a brain injury or to prevent them. And I'm looking forward to talking more to you about that. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and I am with today's guest, Leona Burkey, Executive Director of Brain Injury Nova Scotia. In the first half, we talked about what is a brain injury, how many people are affected in Nova Scotia, and how do you recognize if a brain injury has occurred? And in the second half, we'll talk a little bit more about what can you do when a brain injury has occurred. So, Leona, it's great that you are back, and if you can tell us a little bit, what does somebody do, or the parents or a loved one, if their relative or themselves have a concussion, have a brain injury of any severity?
Unfortunately, in Nova Scotia, there aren't a lot of services available through the public system. So typically what would happen with a more moderate to severe brain injury, if the person is lucky enough to go through, we have very good neurosurgical and neurology care at the higher levels in hospitals, particularly here in Halifax. So a typical pathway would be someone would be admitted, say, after a car accident, and if a brain injury has occurred, a lot of folks will spend time at the Nova Scotia Rehab Center here in Halifax, and that is more of a focused rehabilitation effort to basically look at what issues may be happening due to the brain injury. So those could be cognitive and communication problems, executive functions, those types of things. And we have very good staff over there and a really good acquired brain injury program. The problem in Nova Scotia is when people get released from the hospital system, there's very little available to them in the community. And a lot of people are sort of left to fend for themselves, family and caregivers and the brain injury survivor themselves. A starting point for a lot of brain injuries is to go through a neuropsychological assessment, which is basically a special battery of tests designed to measure brain functioning following a brain injury. So through the public system, the wait time can be up to 2 years for a neuropsychological test. Yeah, so that's a problem. And in the private system, they can cost thousands of dollars. So people are kind of stuck, if they want to pursue treatment actively. Oftentimes, once you leave the hospital setting, there's very little available outside of the private sector. So by the private sector, I mean private neuropsychologists, private psychologists, and also private rehab options, which is often available through physio clinics, private physio clinics that are getting into the business of concussion management and brain injury rehab that's based sort of in the community. So a lot of those interventions ideally are sort of multidisciplinary. So, people can take advantage of occupational therapy, physiotherapy, psychological therapy, all in the aim of basically looking at two essential processes. One is restoring functions that can be restored through therapy and rehab and ongoing work. And then also the process of learning how to do things differently if your brain function can't be restored to pre-injury level. So it's quite complicated for folks that have moderate to severe brain injuries. And for those on the milder end, certainly don't feel like it's mild, especially if they have ongoing symptoms. But a lot of people are finding success through services acquired at private physio clinics that are getting into concussion management. We have several concussion clinics operated by medical doctors through Nova Scotia that people are seeking help from as well. And a couple of alternatives that people are talking lots about, including interventions for visual issues, so prism glasses and the like that people are accessing through private optometry services. And then a lot of people are also exploring more mindfulness practices such as yoga and things like that to help them over time. But it's difficult to outline the services that are available because outside of the hospital system and outside of Halifax, there's very little available in the community for people. So that's one of the biggest challenges that we face as, the brain injury community and us as well as an organization.
Yeah, now you outlined several options for brain injury rehab that are certainly extremely important and necessary. How do you see the role of nutrition and targeted supplementation in healing a brain injury? I know it's a controversial topic, but for myself, I feel that a nutritionist, dietitian that is knowledgeable in that subject can benefit too. What do you think about that?
Well, I mean, anything that any nutrients that help brain function, of course, would have a connection to, keeping your brain healthy over time. And if you're in a situation and you have a brain injury, certainly paying attention to the best foods for your brain function and brain health and memory are important to consider as well. Some specific foods that I can tell you about and nutrients are things that contain vitamin K and folate, such as avocados. Avocados are a wonderful,
Yes.
a wonderful food. They're rich in vitamin B and C and
good fats
this kind of thing. But basically, the foods that your brain loves includes things like deep water fish, anything that's rich in the omega essential fatty acids. Those oils are essential. Fatty acids are essential for brain function.
Yes.
So certainly paying attention to those kinds of things. I mentioned avocados, nuts, seeds, berries. Basically, you're looking at the category of foods that, that have a lot of the omega fatty acids and then a lot of the antioxidants and what have you that are found in berries.
I couldn't agree more. I feel a whole food, varied diet with a high portion of colorful vegetables, fruits, and healthy fats will help not only the whole body but also the brain heal. So I'm very happy that we share that opinion. Why don't we talk a little bit more about what you're doing with the Brain Injury Nova Scotia Association? What's your goal? What are you focusing on? What services do you offer?
Yeah. What we're a relatively small organization for the numbers of people that are affected by brain injury, and that's been always a challenge for the organization. And I think that there's a few reasons for that. Many years ago, brain injury was certainly not a matter of public discussion as much as it is now. Increased awareness around concussion and long-term effects of repetitive concussions have really kind of made things a lot busier in our world. But one of the main focuses of the organization for many years now, and indeed since it began, was to play a large role in advocacy, to try to keep brain injury on, the Department of Health and other government departments, to keep it on the radar. There are many, many issues in the brain injury community, not just dealing with health, but also with community services and access to community services. There are issues in the justice system. There's a lot of issues with lack of support in returning to education and employment. So it really covers, all areas. And a big part of the organization's work over the years has been to educate and inform, our policymakers on the importance of this issue. And as of late, all of that advocacy work, did culminate in a major project that is yet to be released, but we're very hopeful that we'll be able to move some of this work forward, and that's an acquired brain injury strategy for the province. So that's a provincial coordinated approach to try to develop services so that people can continue their journey of recovery and not have that just stopped for them, when they're released from hospital or what have you.
Wonderful. Now that is an exciting and very important, sorry to interrupt you, it's a very important topic.
Yeah. But and then day to day we also have, we also offer information and resources to people. We have some social media platforms that people are connecting through, and we also offer education and peer support via our chapters and a peer support network that's across the province. So that really helps us, connect the brain injury community despite being very small. So we have active educational sessions and workshops here in Halifax. We provide education and training to employers. We provide concussion information to the sports community as needed. And all of that stuff is evidence-based, of course, because we try to, base our information on the latest science. That's very important. And through our peer support network, we're able to offer some support to people, namely that they don't feel like they're all alone, and also to share resources and strategies with each other as we continue to develop our own services and programs.
Now that is wonderful. And I am sure if people would like to support you, they could volunteer or they could donate some money. And that is a nice thought to bring us to the end of today's show. And please don't hesitate to contact me with any questions, thoughts, comments, or suggestions, or if you'd like to contact Leona or the Brain Injury Association Nova Scotia. You can certainly contact them directly, or you can email me and I'll connect you. My email here at the station is Christine, CHRISTINE @communityradio.ca. And I'm always grateful for any feedback. I also want to extend a special thank you to today's producer, Jim Francis. You might not know this, but this is a volunteer-run, non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio, with live stream on communityradio.ca for the next episode. Goodbye and have a great day